Today we're going to talk about, Brad, how to sleep with a herniated disc.
Is that like sleeping with a pillow?
Bob and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet. I don't know why we're still laughing about that.
In our opinion, of course, Bob.
So today we're going to talk about some different ways that you can sleep with a herniated disc. I guess first off, Brad, if you're not having pain or leg symptoms when you're laying down and sleeping, you're probably doing fine.
Right, yeah, because typically with a herniated disc, you will have symptoms, numbness, tingling down your leg, all the way to the foot.
So let's talk about the first one. This is a good one, Brad, if you're really having a lot of pain.
Right.
This is one you may not even necessarily want to sleep with. This is something you might want to do right away, the 90-90.
Treatment, yeah, okay.
You want me? I can lay down.
Oh, go ahead, Bob, lay down.
Got two pillows.
Usually, what you want to do is get in a 90-90 position. If you're a therapist, you know what it is. If not, we're going to show you. Here, you want to get the hips at close to a 90, which we're not there now, but Bob's tall. But this would work probably. And then your knees at
Around
close to 90.
So you can do this by laying on the floor and putting your feet up on the couch,
right,
Brad, or
yep,
a chair.
or a piece of furniture.
Yep.
You know, you got something soft under there, helps out.
Right.
And then once you get in that position, usually that takes stress off of that disc.
Right.
And if it's tender back, you can take a cold pack. Are you ready for this, Bob?
Yeah. Okay, you can take it out.
The drama king. Gosh, it's kind of a
drama
wimp,
queen.
A wimp.
Still cold.
But if you really got a sore back, that cold will actually probably feel good, particularly after the first minute.
It's going to help us any spasms you're having.
Sure, you bet.
So, want to take that out, Brad? I'm going to show them one way to get out of bed. You want to roll like a log. You know, you roll your whole body, shoulders, everything together, and then you're going to put your legs off the edge, and then you're going to push up like this, so you're keeping your back straight.
Right.
You want to show the other way, Brad, for getting out? Going stomach first.
Yeah.
Getting in and getting out.
Let me see how we can do this.
Watch out for your mic.
Can, yep. If we're going to roll, if you can, roll to your stomach gently without it hurting too much. This, I like, it works quite well. If you come over, one leg comes off, slowly keep everything here straight like it's in a cast, and then you walk up with your arms, get the other foot down. I just did this with a person yesterday.
Yeah.
And you slowly get up, keep it straight like there's a 2x4 taped to your back, and there you go.
Yep. Sounds good. And I mean, for getting in, you'd be going in like this. Too, just
reverse it.
Yep. When I had back pain, that was the only way I could get in and out of bed. So that was the one that worked for me. All right, the second thing you might try, if you're having pain when you sleep at night, is just take a sheet and roll it up. And you're going to roll it, and you're going to put it all the way around here, and you're going to go ahead and pin it together. Now what this does, it actually provides support for you in the low back when you're sleeping on your back. But even when you sleep on your side, it stops that little gap there and stops your back from sagging.
So you put it above the belt line in that waistline area.
Yeah, in that where you're going to find, I don't want to lay on my mic here, but if I lay it on this side here, it's going to fill in that gap right here.
Right.
And it's going to fill in the gap in the back.
Right. And the reason you put it all the way around, because obviously when you fall asleep, you're going to roll side to side without knowing it, and that way it stays there. You can buy these. They're called sleep rolls. I believe they're made by McKenzie.
I'll try to look for the link and put it down below so that if you want to go ahead and buy one. You said they just tie in place?
Yep, they wrap around. They're a round foam. They wrap around, you tie it here, and it works a little better than that because it's a little, you know, it's more, the density is consistent.
Okay, let's grab some pillows, Brad. The other thing you can do, these are some just general ones you can do. You can lay on your side, and you can put a pillow between your legs, which helps keep your back a little straighter, not twisted. You can also lay on your back and put a couple pillows, maybe 2 or 3, just like this position. Again, it brings it up a little bit and takes some more stress off your back.
Right. Just so you're clear, these are all options. You try any one of them, and if it takes the pain out of your back and particularly out of your leg while you're sleeping, that's what you want to do.
Right, you're especially looking for it to get out of your leg.
Yep.
I mean, that's a bad sign when it's going down your leg.
Right.
This is one I have not tried, but I saw written by a guy I trust. Take the 2 pillows, Brad, and you're going to put your painful side. If you have pain on one side of the back, let's say it's on your left side, you put that side up okay?
So that would be the leg that would probably
Right.
have the symptoms.
And then you're going to put 2 pillows underneath your foot, just like what we're doing right here. And it's twisting your leg a little bit. Your back should be straight. I mean, the shoulders should be straight up and down. But this often, wait a couple minutes. If it makes it worse, take it out right away.
Right.
But if it doesn't make it worse, wait a few minutes and see if it calms down. He has found quite often that takes the pain away.
We're talking
in the
about
leg.
mulligan?
Mulligan, yeah.
Sure, okay.
So,
But you would use a pillow under your head, huh, Bob?
and a pillow under my head, of course, yes. All right. If your bed is saggy, okay, you have an old mattress, you're going to want to look and determine whether or not you need to replace it. And the way to do that is, one, you could take the mattress and put it on the floor, because that'll give it support. Or 2, you could take some plywood and put it between the mattress and the box spring.
Right, if you're short on cash and you can't afford to replace
What
it.
we did when I was younger, when my wife and I first were married, we put some plywood between to extend the mattress. So
We don't have
shut
to go
up.
there.
I know what he's thinking about already. You talked about, you had a patient that slept on the floor.
Right,
too, right?
yeah, and she had pain down her leg and a carpeted floor, and this is from a Mackenzie class I took. They said that's an option, and sure enough, she could sleep on the floor, reasonably comfortably. In bed, she could not because her leg pain was so
I
bad.
think if you took one of those little foam toppers and put it on the floor, that would help a lot.
Yeah,
wouldn't it?
yeah, that
So,
would be.
The last thing is, I don't really recommend this to a large extent, but we've had a lot of patients, I've had a lot of patients that sleep in a recliner. They just couldn't sleep anywhere else. And for some reason, it takes away the pain. And I would recommend, if you sleep in the recliner, put a little rolled towel behind your back, or something small, some type of support. Yeah, just to keep you in decent, I don't want you slouched all night long.
Right,
That's going to be bad for you. So those are some of the suggestions. And Brad,
Oh, yes.
just a reminder.
We got the red book.
Yeah, we can fix just about anything, but we can't fix a broken heart.
But
Look how that heart just broke.
Yep, we just put her back together like that. If we got some Elmer's glue and some duct tape.
There we go.
There you go.
We're handy.